Welcome to the North Carolina Medical Society Spotlight. I'm your host, Sue Ann Forrest. Today, we're in Charlotte, North Carolina to learn a little bit more about a new and innovative practice approach at Thrive. Listen to learn more from our two physician owners of this practice.
Both for joining me today.
Absolutely. Thanks.
So why Thrive? Tell me what this is and how this is different.
So Thrive is, we were both OB-GYNs in the community, have had over 20-year history of practicing in Charlotte. But Thrive is a practice that's based on functional medicine, and functional medicine is a little new to the Southeast, but it is a systems-based approach to healthcare. So you're not just dealing with gynecology or neurology, you're looking at the person as a whole. So that is our platform. Yes, we're OB-GYNs, but we're also certified functional medicine practitioners, so we do more of a whole body approach to healthcare, looking at the why people are having the problems, not looking at the symptoms. So it's a little different, and it's a little new for Charlotte, but people seem to know about it, and it's a big buzzword now, and we're getting people not just from Charlotte, but outside of the community driving in 3 or 4 hours because they want somebody who has that approach to their health.
Right. So you left your system practice and opened this. Can you tell me a little bit more about why and the purpose and the meaning behind why you decided that this approach was a better approach to healthcare?
I think we both just felt that we weren't serving the needs of our patient. We've been cornered into this box where we could, have X amount of time with the patient and really weren't addressing their overall health. And we really both strongly value, the whole aspect of the patient, mind, body, spirit, the role of their diet, the role of stress, lifestyle measures, and just knowing that all of these chronic diseases are crippling this country. It just is unsustainable at the rate that it's going. And something has to change. And we felt so strongly about it that we were like, you know what, we're going to go for it. We believe in it. I believe in it for myself. I believe in it for my family. And I believe in it for my patients. And because the model didn't really exist here, we looked around the country and had done a lot of outside training. And we were like, you know what, we're going to go for it, and we're going to create it, and we're going to give it our best chance effort. And we've been very pleased so far.
Yeah.
So yeah.
And I think patients are looking for something different. I feel like they don't feel like they're being listened to. They don't want another prescription. And unfortunately, and certainly in the Charlotte community, it's like an assembly line. And the doctors, they can be great doctors, and I think we have tons of great doctors, but they're working on an assembly line, so they've changed their approach to, I just got to put out the fires. Who's not going to be alive tomorrow? That's what I got to look for. I can't, prevention, forget it. I can't talk about prevention. I can't talk about trying to get to the root cause of why you have this issue. I'm just going to try to take care of the symptom. And it's driving that type of treatment. So you've got really good doctors who are forced to work in really bad environments, and the patients are feeling it now. They don't feel like they're getting listened to, they're not getting taken care of. They walk out of their doctor's offices with 3 prescriptions every time they walk in, and they're looking for something different. So that was sort of the surprise to us, was how many people were looking. So we have 4 physicians that are here, and we also have a PhD psychologist, because that's a big component of care when we're talking about lifestyle and stress management. We have nutritionists, and we have 3 health coaches to help patients implement it. And then we also have an acupuncturist chiropractor who sort of gives some of that alternative therapy, because there's definitely places for that too. And then we have things like massage and yoga and fitness. I think a big sort of something that functional medicine is based on is educating patients and motivating them to take their health care into their own hands. Because at the end of the day, it's not what happens in our office, it's what happens when they walk out of the office and what they do at home. So we have lots of nutrition classes, we have cooking classes, we have a teaching kitchen here. We try to have educational medical classes to try to teach them about underlying conditions and things they can change to avoid going into those directions of disease, and that's been really very popular. So, and you don't have to be a patient to come to them, because we want to make sure people in the community are able to get that information, because they may love their doctor and not want to change anything, and we're not trying to take people away, but we are trying to get them to look at being a little more preventative, taking control of their own health.
So how much time do you spend with a patient per visit? I think that's an interesting difference in your approach.
I mean, our average visit's 45 minutes to an hour, and on a new functional integrated medicine intake, that's an hour and a half, like 90 minutes. So, I mean, sometimes people are only here 20 minutes if they've got like a really simple follow-up issue. Right. But otherwise, we allow a lot of time for the patient's visit, which is awesome.
Yeah. And they stop, they feel like they're getting so much more in that time. You think, oh, because of the way our office is a cash pay, not that they can't still bill it to their insurance, but they never complain about that, because they feel like, I've gotten more in my visit here than I've gotten in the last 5 years at my doctor. I've had more minutes in one visit than I have in the last 5 years with my others. So we were a little worried. We felt like we were treading on thin ice with that, but patients will pay for things if they feel like they're getting the service.
I could see this, going into communities. I know you touched on that earlier.
Yeah.
That's a part of your model, is taking that not just here, but kind of reaching out beyond this office space into the education world.
And how can you do that in underserved populations, which again, there's such huge need for that. And there are practices and models around the country that do that. I mean, we haven't really taken that on in any huge capacity yet, but that, that would be great. I mean, how do we reach that part of Charlotte that needs it, and the country as a whole? They need it more, right, than somebody can walk in here and pay for everything, right? Some of those other communities are in desperate need, and we just have to brainstorm as a community of physicians, how can we get this kind of stuff to them? It's going to take more than one person to do it, but we need to.
Right.
So many physicians are just overwhelmed, right? I don't know where to start, and it almost has to be like a grassroots movement to take it back. And the patients are making it easy because they are dissatisfied, and I mean, especially in this community, having worked in both systems. But we know that patients are dissatisfied and physicians are dissatisfied, and the country is sick and unhealthy and exorbitant healthcare costs, and I mean, we have the highest healthcare costs among internationally out in the world, and we're
spend
not any healthier.
Right, we spend so much more and we're sicker, and so it's not working, and the only way it's going to change is through the physicians and the patients. If we think that government or hospital systems or pharmaceutical systems are going to change it, there's no way. They're all doing great right now. They love the status quo. But the doctors and the patients are the only ones who are going to change. And so, I mean, we hope that we're just a flicker of change that's to come. But what I would say to those people who, want to make a change but they're scared is you can do it. And we did it. And we laugh about just how when we started it, I mean, it was just a belief. Yeah, there were fears, but they were really a little unfounded. I have no doubt that any physician who really believes in doing the right thing is going to have success.
Right. We enjoyed talking with you. It's been very inspiring. I wish you'd open up a practice in Raleigh, maybe.
Maybe.
But it was so nice getting to know you, and thank you for taking the time out of your busy practice to talk with us a little bit.
Thank you.
Thank you.